the Black Doctors
Hey there,
podcast.
it's Steven, host of the Black Doctors podcast. This week you're going to hear from Dr. Nate Jones, co-host, pediatric emergency medicine physician, and Dr. Bianca Busch, who is a child and adolescent psychiatrist. I have been super busy with traveling and conferences and critical care boards, so they have taken over and covered down for this episode. I really enjoyed editing this fantastic conversation about anxiety. As a reminder, this is not medical advice. We are only having a conversation. Nate, take it away.
Well, welcome everyone. Welcome to the Black Doctors podcast, the show where representation matters. I'm Nate Jones. I'm filling in as host while Steven is away studying for boards. So let's all pray for him. Hopefully next time we see him, he'll be all done and happy. But I'm not completely alone today. I'm joined here with a dear friend, an amazing psychiatrist, Dr. Bianca Busch. She's here to help guide our conversation where we talk about physician anxiety and stress and how we deal with and manage that. So she's otherwise known as the college psychiatrist. She's the founder and CEO of the company of the same name. She and I both did residency together at the University of Chicago, and she's doing fellowship in adolescent psychiatry at Harvard's Boston Children's Hospital. Currently in the Dallas-Fort Worth area, and sees patients all over. I can't name all the states that she sees patients in, but you can check her website to see. And she was featured way back in season 1, and we're happy to have her back here. So let's welcome Dr. Busch. Hello,
Hi,
how are you?
I'm so glad to be back. Yes, thanks for having me.
It's so good to see you. It's been so long. I haven't seen you since last year, I think, for Steven and Christina's reception. Yeah. Oh man. Well, welcome. So hopefully you're not anxious or no anxiety for this show. So we should be okay.
No.
It'll be good. So I wanted to start off with just sort of getting some background, an understanding of anxiety and how we understand anxiety. How do you sort of approach patients and just in general when they sort of try to understand what anxiety is?
Well, anxiety is a normal response, right? It's getting your body ready for whatever is coming up ahead, right? So if you see a tiger, a snake, in my parts, it's a snake, your body becomes alert, aware. You're looking around, your body is ready to make a move, to run. And so that is anxiety, and it's normal, right? It would be abnormal if you see that snake, if you see that alligator, wherever you are, and you're just chill. You're not worried at all. That is unless you really like snakes or alligators. I don't.
Not me. Snakes, spiders, all the above. Get away. All other living creatures. I'm good. Thank you.
So it's really a normal thing, and it's just helping your body get ready. And so that's where I really like to start, because not all anxiety is bad anxiety. It's giving you a warning. It's helping your body get ready for what's a danger that's up ahead or for a test, right? It's sort of sharpening your mind. Now, a time where it is not helpful, where it is abnormal, normal, as we say, is when it starts to get in the way and you have so much anxiety that you can't go on and function in your daily life. And so we'll talk on a little bit about what that looks like exactly, but about, in general, the Kaiser Family Foundation has some statistics from 2023 that about 40% of the population endorses some symptoms of anxiety or depression. That's a lot of people. It's almost half. But only about 3% of the population, according to another source, is diagnosed with generalized anxiety, and 19% with any anxiety disorder at all. So the anxiety disorders include generalized anxiety disorder, panic disorder, specific phobias. So that would be our spiders, snakes, those kinds of things.
Ever since I saw that movie as a kid, it has totally disrupted my ability to see spiders. So I see anything with 8 legs, I'm out of here. So yeah.
I'm like, who let you watch that as a child?
My babysitter let me watch it. It was terrible. So I'm horrified of spiders now. Absolutely terrible.
So yes, those phobias, obsessive-compulsive disorder, social anxiety disorder. Those are the most common anxiety disorders.
And help me understand, because I'm trying to remember my 8 weeks or 6 weeks of psychiatry back in med school. So the idea of disorder versus just anxiety, how do we sort of understand those two different things?
Yes, it really is if it's impairing your level of functioning. And so according to the DSM, there's going to be sort of different, more specific criteria about sort of how long it's been impairing you. But, just think about it. If you are, thank you for being so open about your arachnophobia, right? So is it really that if there's a spider in your house, you can't even be there.
I'm
or
burning
you
down the
can't
house.
even, yes,
Right.
or if you have so much anxiety that you just can't even get out the door, right? Like I had some students who have had so much anxiety that they can't even get to class. They start walking to class and they stop outside the door because they're just like, I don't want to think about having to speak out loud or answer questions or be in front of my classmates. So it's really that it's getting in the way of your everyday things. That's what makes it a disorder. Another one that people is really talked a lot about now is social anxiety disorder. And, there's a difference between the disorder and sort of just not really liking to be
The
social and
typical
being more of an
introvert type.
introvert.
Yep.
And so, people who have social anxiety disorder, they might just be avoiding all outside interaction, really just staying home, not wanting to go out to different restaurants. That's different from, okay, you go out to a restaurant and hang out with friends, and then you need to take some time and spend some quiet time, right? So we're just looking for these disorders to disrupt your normal everyday function that would be sort of appropriate for your age and station in life.
That makes sense. And then thinking about particularly with physicians, I feel like we're all, at least maybe me, just high achieving, anxious child that became an adult.
Yes.
How does that look for physicians, and particularly physicians of color? How does that look? How does that kind of show up sometimes? Yeah.
So I'll say just the things in general, and then I'll talk a little bit maybe about physicians of color. So a lot of things, one of the big things I think about is avoidance of work and deadlines, right? And so this is a very common thing with anxiety. It's the avoidance cycle. You're like, okay, I'm just going to put off, I'll do that note a little bit later because you're not sure what to put in the differential, or you're not sure, and so you just avoid it. And then it's been a day, and then it's been 2 days and 3 and 4 and 5. And then the clinic manager is like, you have these overdue notes in your in basket.
Yeah.
We need you to sign them so we can submit for billing, right?
Right.
So that is how it can look up, right? Avoiding things, work or deadline, procrastination, just not even getting started on something. And that could have been the notes too, but just not getting started on a paper or reading articles because you're not sure you're going to get it done, or that kind of thing. Irritability. So just being kind of grumpy. And so irritability can be actually a number of different things, but sometimes we see that with anxiety. Just negative thinking, really tuning your thoughts to the most negative outcome, really snowballing, right? Okay, if I don't do this research project, I'm not going to have enough on my resume, which means I'm not going to get into the fellowship that I want. Or if I don't have the right, just sort of really going down the rabbit hole where you've gone from point A to point Z very quickly. So that is a part of negative thinking, or what we would call cognitive distortion. Worried that others might perceive you negatively. And so, that can be manifest in so many ways. Going to rounds, worried that people are going to say that you're dumb if you ask a question, or if you don't answer correctly. Poor concentration, not being able to focus. Just being disengaged with your work, sort of kind of showing up in you get so tired of being anxious, you're just like, whatever, I'm not even gonna.
Yeah, you need a break. You need to not shut up, avoid that stimulus as possible, right? I'm gonna take a break. I need a vacation. Exactly. Yeah.
Yeah. Intense, even irrational fear of failure. So just thinking oh my gosh, I'm going to fail this thing because I'm not good enough. I'm not, smart enough. I haven't done enough X, Y, or Z. I'm just listing a lot of things. Racing thoughts.
Yeah. All those things come into play.
Racing thoughts about work before you go to bed, or even while you're at work. Inability to present during rounds, right? You can't even speak when it's your turn. And this might be more for trainees,
right? But
when it's your turn to present your patient, you just fumble over your words. You forget the differential that you had, which is really unfortunate because, it may not show exactly what you know, right?
Right.
Mind going blank when you get pimped. Again, this is for trainees.
Right.
Gosh, this is a terrible situation.
So bad. It's so bad. The amount of times my brain is frozen and I'm just frozen in fear, which is always like a troublesome. And it's so hard to recover from that too. Like it just, it's a cycle.
Yes.
Right.
And I'll say it is. And I can remember like a time when I was in OR during my clerkship in medical school, and the surgeon, was a general surgeon, pointed to a piece of abdominal tissue and asked me what was the embryonic origin.
Lord. I cannot. How is it relevant?
Sir.
Right. Oh my God. Right.
So I was definitely anxious, right? And I'm gonna just take a quick segue into like maybe how it will show up in Black physicians. So I had the mask on, but I rolled my eyes. I was like, "Are you kidding me?"
Right. Like, what are we talking about here? Like, I was like,
he said, "Don't roll your eyes." Attitude. We'll segue into that. Before I get to that, let me go back to two other things. Failing exams, despite having been well prepared, you studied, and you get to the exam and your mind goes blank and you freak out like, I don't know if I know this material well enough. You just sort of get thrown off your game. So that's anxiety in physicians, board exams, shelf exams, and then not wanting to socialize at all. As we talked a little bit about that with the social anxiety disorder.
I think you just described all 4 years of med school for me and part of residency. Literally all the above. And because it's so common, like you said earlier, it's so pervasive. And all those things happen. And I do think that also the medical environment that we're in doesn't really built to avoid anxiety. In a lot of ways, it kind of perpetuates it.
Yes. And, I don't think it's often that someone might see you underperforming and say, oh, this person might be anxious, or this person might have a different learning style, or this person might have different learning needs, right? You are just seen as incompetent, right? You might even receive a professionalism violation. You might have to repeat different aspects of your training, right? And this goes hand in hand with other mental health conditions, right? And so, no, there's not a full way of acknowledging these things, or it's just not happening, right? Because we're not the patients, right? We're supposed to be the people who are well, the people who are taking care of patients.
Right. We're not supposed to see the ones that are flawed, the ones that we actually have our own issues.
Right.
When a large part of it starts in the beginning of your training, when you're actually, before you even become a full, licensed independent provider, like you literally are ingrained with a level of anxiety.
Yeah, absolutely. And I think that's what's really important when we talk about anxiety for people of color, because we bring so much. Not only do we have the anxieties about our intelligence and how we're presenting, right? Like that's just kind of normal stuff, but we bring all of our life experience and how we present to the world to our work, right? So being anxious about, are people going to see you as a physician, or are they going to see you as transport? Right. That can leave someone feeling anxious, right? There are just so many instances. Are there going to be other sort of microaggressions that you encounter, micro or macro, from your patients, from your colleagues? And so, that can cause us to be hypervigilant, which is,
it's like the snake or spider that you just mentioned earlier. Like literally, it's like really is that snake or spider that they're looking at again and again and again. So,
yes, exactly. And so, you might be worried about how others will perceive you, and it's not all in your head either, right? Which is a tricky thing, because it's like, are people going to be seeing you as competent? Are people going to see you as not competent? I mean, so I think that it's more than just sort of probably a genetic predisposition to an anxious temperament. We have the life experiences, how we exist in the world, that can add to our anxiety. And, I would say for Black physicians, the symptoms are going to be the same, and I'll highlight a few that might look a little bit different. I talked about sort of attitude or irritability, right? And that is one that, we might see with each other. And if we dig a little bit deeper, it's like, okay, people are just anxious about it, right? Like me, my example with the surgeon, I'm like, are you kidding me? But I'm like anxious. I can't remember what the embryonic origin of that tissue is. And so I might be perceived to have an attitude. Angry. And I've seen this actually particularly in psychiatry, not just with physicians, but also with patients. Like I definitely have those consults where it's like, this person is psychotic. No, they're just angry and trying to advocate for good care. because they're anxious.
Exactly.
They're worried that they're not going to get good care.
Exactly.
And I think that we can present in similar ways if we are being treated unjustly in the workplace, in our training programs. And so we may be perceived as angry, but it's also about, that's the underlying is an anxiety potentially.
Right. I mean, oftentimes that like, there are times where, if you've been attacked once before, being asked like random questions at random times of things you're not going to remember at 4 o'clock in the morning or, on 8 o'clock during rounds. And just
After
knowing
you've
that
been
like,
up all night.
Right. Like literally, like it also has no indications of your ability to do your job
No.
at all.
No.
But it is a level of just like, oh, like that is the way I can protect myself in some ways, right? Is some way an adaptive, and I guess in that environment it's maladaptive in some ways, but it's how you survive. It's like you have to be tougher. Yeah, but in the same way as that being tougher, being a person of color and being tougher also can work against you as well too. In particular, in some environments also, So, which is a tightrope.
It is a tightrope. I mean, can you imagine saying, regardless of, can you imagine saying on rounds, I'm actually anxious? I do know the answer. Can you imagine? Wouldn't that be like revolutionary?
It would be. I mean, can you imagine if there was a space where people would like, I expect that from you, but like, I feel like the whole team would dissolve. Like no one would know what to do. They would have to call your program director. You're like, exactly right.
They would call your program director. And
right, your dean. You'd go to like some
check in with Nate
because he's anxious, or maybe you should change the style of teaching so it doesn't feel threatening. I don't know.
Maybe that.
Right, maybe exactly. That. Right. One of the things I try to do it as an attending, at least I try.
Yes,
maybe my trainees would say differently, but it's real. It's those things where you're just like, if you had a real safe space, you'd be able to sort of say like, hey, the way you're asking me that question to me feels threatening to me, or I don't feel safe being able to answer that question, or even like, oh, I don't know. The safety in being able to say, I don't know, like the power in that.
Yes.
Which we're expected to do, even as attendings, we're expected to be able to say when we don't know something. But as a student or as a resident, you're expected to know everything, which doesn't make a lot of sense.
No.
But yeah, that resonates a lot in terms of all the ways it can sort of present itself, and also ways in which like it can be misconstrued and misrepresented and misunderstood. Because I think that's always a classic thing that I think so-and-so's got an attitude, so-and-so's bad about, like, it's like, also you could be upset about anything else.
Right.
It could be a bunch of things.
It could be. And one other thing I would say is like, this touches on more the social anxiety is like, I don't know if anyone ever would say this, but they'd be like, so-and-so is incognito. We don't ever see them. See them.
Right.
That could be social anxiety, right? It could just like, they're not coming to the party. They're not coming to the happy hour. They will not be there. And that could be social anxiety too.
Right. In a lot of ways, it's respecting people for that space too. In some ways, I think we sort of want to pull people out of their shell. It's sort of never a thing that I think makes sense a lot. Like people create a shell because it's where they feel safe.
Yeah.
So they're in a space where they feel they can get out of that shell. I think it's okay as well. But I agree with you. I think when I was in training, for most of my training, I kind of avoided spaces that were lacking diversity because I felt those spaces to be less than safe. And my decision to protect myself, so I wasn't so anxious, was that I would be spaces that were like the House Staff Diversity Committee or something where I felt like I could be, it was more of an inclusive space where I can feel to be myself, particularly coming from other marginalized parts of my identity. And so that level of like avoiding in some ways is sort of like, well, if you're not part of the predominantly white space, then how are you networking? How are you being able to make connections and being able to sort of like to shine on evaluations? And so it's such a difficult rope to walk in terms of doing both. So I wish there was some magic, and we'll talk about that a little bit later about like something we can try to figure out. So there's hope. There's hope, everyone. There's hope to get through this. Definitely hope to get through this. Definitely hope. But I want to get back a little bit about thinking about like on the idea of being able to say how you feel and stigma, like how it relates to stigma. How do you think we as physicians, I know there's been a lot more of an awareness as the mental health of physicians, particularly in the setting of COVID, and the work that people have done. Do you think overall like the trend has gotten better? Do you think we're kind of like stagnant? Do you think we're actually getting worse in terms of how we acknowledge our own like humanity in some ways?
I think it depends on the state you're in. I think it depends on the area of medicine you practice.
That makes sense. Yes. Mm-hmm.
So I think in general, for the entire population, there's more awareness of these things, of mental health conditions, anxiety, depression, other kinds of things. So I think overall things are getting better, but I think in medicine, we still have a ways to go. When I was in the Illinois Psychiatric Society as a resident, one of the members successfully had some of the really kind of intrusive questions removed from the physician application about mental health conditions, right? Because a lot of states you have to disclose them, and then that can lead to, you're having to check up with physician health services annually or that kind of thing, right?
Yep.
And so, that really is a disincentive for people to, one, report what's happening for them and to get care, right? Because they might have all this sort of compliance that's associated, or they're worried about how it will impact their license or how they're seen amongst their peers. So I think there's a lot of way to go with that. I mean, if I could make a recommendation, I would try to privatize that process as much as possible. Not to the extent that people are on the job doing harmful things by any means, but that if people need to have an antidepressant, they can have it.
Right. Yeah.
It's just an antidepressant.
Exactly. Right. I mean, even when you get jobs, when you go through the occupational health, they make you disclose all medications that you're on, and I think there are a lot of medications they're not going to be able to figure out through your urine samples, but some of you have to disclose because they could be a controlled substance, in which case you have to be able to identify the prescription for it. But I remember, like, I've always dealt with anxiety and depression. Those two, obviously, like I think are like left and right hand for a lot of people.
Absolutely.
Right. And so I always feel like when I remember as a student trying to figure out, like, do I get treatment? Do I see a therapist?
Wow.
If I see a therapist, are they going to know? Do I have to disclose this? And luckily, I've had amazing therapists through most of my life that have helped sort of walk me through those things. But yeah, I feel you. It's just like there's a lot of stigma when it comes to being a physician with any type of, barrier or emotional, physical, or otherwise. So I feel like there's a lot of like pop in circumstance, like we're doing better as a profession, and I don't really know for sure if that's the case.
I don't know either. I mean, I hope so. And then again, this is all anecdotal, right? Like, I'm not right at this moment affiliated with an institution or a national body who's addressing these things specifically in physician populations, but I think in general things are better. And that gives me hope for the future too. So I think there's a lot of advocacy that could be done sort of the state level and probably even hospital level. Like, I would love to see, and we'll talk about sort of what to do, but I would just love to see services be available, readily available for physicians.
And that's open, and not only open, but expected that you would take these services and without like a second glance of any of your higher ups to be able to say one thing or another. So 100%.
Like, it would almost be like, good for you.
Right, exactly. It's almost like, good for you going to the gym today. Like, you did your physical wellness, you actually took care of your mental wellness and emotional wellness as well. So I think it's always like one of those things that I'm just like, there's so much more we can be doing and so much we can be doing. But stigma does play a larger role in that, particularly as a trainee, but even after training, you still have that part of it. So definitely so. So, well, I think there's a good point to take a quick break, and then we're going to come back and we're going to talk more about ways to manage anxiety and where to go from there.
All right.
Hey, it's Steven, and I am back just to let you know that registration is now open for the 2024 annual medical education conference that's put on by the Student National Medical Association every year. This year, it's going to be taking place in the city of New Orleans, and the dates are March 27th through the 31st. The theme for this year's conference is From Pressure to Purpose, Illuminating the Path to Excellence, and this is going to embody the spirit of the SNMA. This is also the 60th anniversary, so we got to show out, we got to do it big. Registration is open. That means early registration is open. You can save some money if you register early, which is before November 14th. Goes up to regular price after November 15th. So visit snma.org and sign up today. You don't want to miss this conference. If you are a pre-medical student, medical student, if you're a resident, go represent your program. Always so many gems to take away. So now we'll jump back into our episode with Dr. Nate Jones, Dr. Bianca Busch. As another reminder, this is still not medical advice. We're just listening in on their conversation. Thanks for joining.
And we're back. So just so you guys know, we're just having a great conversation about anxiety as a physician, and anxiety particularly as a Black physician. So the first part, we just talked a little bit about some background information, and now let's get to how do we actually manage some of the stress, and how do we manage the anxiety here? So Bianca, what for you, what are your go-tos when someone comes to you, particularly as a physician, and sort of what do I do? I'm exhibiting the things you talked about before, where I'm avoiding deadlines. I don't want to go to rounds. I don't want to do these things. What do you tell people to do? Maybe the immediate stuff to do, or long term, or what were your thoughts?
Well, I always like to start by sort of assessing what all else is going on in their lives, right? So basic stuff, sleep, nutrition. Hard sometimes as a physician to have, good habits in those areas.
Right.
But that is a place where I like to start assessing. Obviously, I like to also think about, is there anything else physical going on with your body? Any other health conditions that could be contributing to your anxiety, thyroid dysfunction, all that kind of stuff. So I really start thinking about that. And then I start to think about, okay, are there things that we can do to change your environment to help you cope with this? Now, I'm thinking about, all right, what are you doing on your off time? Are there ways that can really help, things that you can do to help you decompress to make you more ready to go to work? And let me say this, working with a wide range of physicians and people along various paths in their training, the therapy might look different, right?
Right.
If it's you're a trainee and you got to get through, we're thinking about that. Do you need to move on to a different program? We're thinking about that. If you're further in your career, are there things that you can work in your hospital system? Are there different roles you can take or give away? Or do you need to move on to something different? So that's a part of sort of the holistic assessment, is really seeing okay, what is stressing you out? Is it your work? Right. Is it other stuff happening at home? And then from there, finding intervenable things again, is there stuff that you can do? When was the last time you engaged in your passions and hobbies? Are you painting the way that you used to? Are you knitting or crocheting? Are you riding your bike, right? And sort of encouraging people to return to those things that give them joy and pleasure. Then also from there, I often think about, are there any kinds of natural supplements or things that we can do that are non-prescribed medicines or more integrative approaches? Do you need to have a cup of chamomile tea at night before bed while you're reading your book?
Love a good chamomile.
Yes, me too.
Yes, love it.
Shout out Special Seasonings, honey vanilla chamomile.
Yeah. Oh, I'm gonna get on that. Okay.
Oh, yes,
it will be
so
in the notes tab. We'll put that resources. Love it.
Sometimes some things I even do for myself is have aromatherapy, right? I have my diffuser going or candle. So really just thinking about all of the possible things that we can do that are non-prescribed medicines. And then from there, thinking about therapy. So, therapy, love, biased because I provide it. Also consume it.
Oh, yeah. As here, I've been therapized forever. I love it every minute of it. Yep.
It's so good. It's so good. Yeah. I think everyone should have therapy.
Right.
Because it's just helpful. But thinking about the different kinds of therapy, there is certainly a lot of very good evidence for the use of cognitive behavioral therapy, or CBT, for the treatment of anxiety disorders. Probably some of the strongest evidence. And so doing that really involves learning about your anxiety and then learning skills to help manage the anxiety and other stressors in your life. So you're going to come away with homework and tips and tricks, and will include things like breathing and meditation and trying to sort of change some of your thinking patterns. So that's a good type of therapy. There are other kinds of therapy, talk therapy, which also help a lot.
Right. Yeah.
And that is a kind of therapy I deliver, also engage in addition to the CBT. And
That's perfect.
Yes.
Like I was like, I
Yes.
support therapy. I feel like I should literally. It's gonna be like on a merch shirt. Like everyone should go to therapy. I support it 310%, 110%. Like I don't think I would have gotten through majority of my training without some really amazing therapists that really sat down and was like, okay, so you feel this. And a lot of what cognitive behavioral therapy, for me at least, was like, let's change the way you think so the way you behave is very different, right?
Exactly.
So that everything is a snake or a spider, right? Like maybe it is just that, and maybe it's uncoupling the idea of like, okay, well, maybe you just had a bad day on round and it was just a bad day. And that it doesn't define you. And I was like, wow, I didn't know this. I thought I was told if I couldn't present, 30 patients within 10 minutes that I literally was the worst medical student that ever was.
That is so triggering. I know, right? I'm so anxious hearing that. I'm like, oh my God, did I remember to check all the labs? Oh my God.
Like they write all the vitals down. I'm like, we have electrical, like everyone should be seeing all these electronic medical records. It's so crazy. But it just speaks to such a universal experience, right?
Yes.
And for those of you who are going through the medical school process or in residency, or even those who are pre-medical, like it is a very common practice, I think, to have a level of anxiety, and it's totally okay.
Yes.
It's okay to have it. It's not okay. It's not okay that it's happening to you. That is a different process. But yeah, it's a common thing. I think that like the amount of times that I remember like the fear of being like coming in from an overnight or to day shift and like being signed out patients. But okay, I have to like remember this is the plan and this is the consultant and it's such a performative way of practicing medicine that is. I know I tend to feel that it's more detrimental than it is helpful in a lot of ways. So, but again, well, that's another episode. My soapbox of why medical education needs to be changed drastically the way we do things. Right. But no, yeah. I mean, like I said, I think therapy is super helpful in terms of just like being either like a physician, like either a medical student or a resident, or like how do you suggest people go about finding a therapist or finding like the type of resources?
That's a great question.
Yeah.
So, first things first, you've got to find someone who's licensed where you are and who accepts your insurance if you're going to use your insurance. There are a couple of great search engines. Therapy for Black Girls is fantastic. We're talking about Black physicians. And I think there's Therapy for Black Men as well that has a good database. And you can search, again, by location, insurance type. My go-to is also zencare.co. I love that because a lot of folks have their availability up to date. And then there's also Psychology Today, which just has a large repository of therapists. So you're going to be looking for someone who has expertise with anxiety. And it will be a bonus if they're used to working with physicians or people in the healthcare field, because they're going to have more of a sensitivity to how do you disclose this to your colleagues and that kind of thing, and sort of documentation and all of those sorts of things. So if you can finding someone who's familiar working with physicians, that's great. It's also, you can talk to your friends if you feel comfortable with like, who do you see? Do you have any recommendations?
Right.
That can be helpful. One other organization I want to shout out is Tend Health. And I actually worked for them right after I finished fellowship. And they really focus on caring for healthcare providers in a very confidential and private way. So they're often have contracts with institutions. For example, UMass, they have a contract with UMass. And so I saw a lot of UMass residents, but they're not associated with UMass. So you're not going into the department. You're not seeing people who you might consult later on.
Right.
It's like a completely separate entity. And so they're now in a lot of different states across the country. So that's another really great source.
Perfect. Yeah. I mean, it's also interesting because that is true that when I think we don't think about it at the time, but when we seek to get healthcare, that oftentimes we may only really get it through our institution because it's usually the cheapest, because usually your insurance is coming from your institution. And I actually remember at UChicago having to go to the psychiatry department. And I was a resident, and I remember being like, I consulted other like psychiatry
Yes.
residents. Like I work with these people, and I
Yes.
remember like sitting down in that office and getting that like little clipboard and like not filling out and just walking out. And I remember just being like, I just could not.
Wow.
I was just so afraid of
Wow.
disclosing that like I need help, and you were going to
Yes.
know my personal life.
Yes.
I did go back eventually and was helpful
legit.
eventually, but but it's like it's a real thing.
Yeah.
I don't
It
think
is a real thing.
that, and I love that organization, the ability to have a separate body that sort of says, "Hey, listen, like we're here to help you, and we're not connected to you." It's like
Not
going to the emergency room.
connected.
Yeah.
Yes.
Yeah.
Yeah, and it's so great because it's like, I don't know, in terms of reporting, it's just, I don't know. When I was practicing and I was prescribing medicines for folks and doing therapy, I felt like so disconnected from the institution that I felt like I could just be so much more helpful to the physicians I was seeing, because no one was going to be able to read my notes.
Good. Yep.
Within the institution, even though those are often marked as sensitive or something, so
right.
No one should be in your business, but it just felt like an extra level of privacy and protection.
And now, does therapy always need to be like lifelong? Is it because there'd be different like ranges? Like how does that work?
Yeah, so the CBT that I was talking about, cognitive behavioral therapy, is really more of a circumscribed kind of therapy. Usually anywhere from 8 to 12 weeks are sort of the protocol. I have like all my books here. Just now working on some fears and phobias with people this week. But so that is often a more of a shorter course. Now, if you're doing talk therapy or psychodynamic therapy or psychoanalytic therapy, which is close to my heart, is my first therapy language. I love it. That kind of therapy can go on for years. I've been seeing my same therapist for almost 3 years now, I think, and she's more of a talk therapy, psychodynamic, analytic kind of therapist. So it doesn't, and you can pop in and pop back out, right? Like I have patients who I haven't seen for 2 or 3 years, and they're like, hey, can I come see you? Because X, Y, or Z is happening in my life. Yeah. And that's okay.
Right. Because life is not linear. Like it goes up and down. It goes all around. Very well. Very well. And what about those who are just like, I'm not doing therapy. I don't want it. Just give me the pills. Figure it out. Like how does that work how do you sort of navigate that process? Yeah.
So, the gold standard is to try a good course of psychotherapy before going to medications. But there are times where your symptoms are, you need to get some help like right now. And so there will be some times where it's indicated to start medication before you do therapy. And you're right. Some people don't want to do therapy. They don't want to talk about it. They don't want to deal with it. Just give me the pill and fix it.
Exactly.
I would try to work with them to have, gain some insight, but you also have to meet people where they are. So, it would be working with a provider who is willing to do that. And I think, a great place, if that is really what you're most interested in, is a primary care doctor, honestly, because they're going to be able to say, they're going to do your PHQ-9, your G87. They're going to be like, okay, looks like you're anxious or depressed. Let's try some Zoloft. Let's try some Lexapro. And that's a fantastic place to start. Shout out to my primary care colleagues who do a lot of mental health care, the bulk of it for our country. So you don't need to see a psychiatrist to get started on a medication. Right.
And I think that's a good point, because I think the ability to get into psychiatry, to be able to see a therapist, sometimes the wait lists are long. And sometimes it may be helpful to be able to get in to figure that out as well. So that's super useful. Cool. And I feel like in a lot of ways too, as like, I'm thinking as a physician or as a full attending, those resources are a little bit easier, because oftentimes you can find a therapist or a psychiatrist. Sometimes they don't take insurance sometimes, and sometimes it's a little bit easier. But it can be a bit challenging as a trainee. And especially if it requires medication or anything. So it's around. I mean, I feel like it's always a journey to figure out what to deal with it all. So those are like the things that you would do. What are some things that like you should not be doing with like dealing with anxiety? Or do you have anything? Sorry.
I just have one other thing.
Go for it. Yeah.
One thing, as we're sort of physicians along in training and along the timeline, that was really helpful, and I think is more of a psychiatry specific thing to do, is to have something called a process group. We had one once a week, where we were able to really talk about what's happening, the dynamics and the drama in our department, which was intense sometimes. But it gave an opportunity for us to talk about stuff. We even talked about race. We talked about, we had a process group leader who really pushed us. Some people didn't like it. Some people did. I'll just have to tell you, he was analytically oriented, and he's Jewish. And I came in and I noticed he had a tan, and I said, "Oh, have you been vacationing or something?" Like just a casual conversation. And he was like he's like classic kind of weird analyst, like you don't know what you're going to get. And he brings it up later, like, "Oh, do you feel closer to me because my skin color is closer to yours?"
Oh my goodness.
No.
Oh my God.
Anyway, it doesn't have to be like that. But at the bare minimum, it's just a place for you. And I lead these sometimes now for the fellows at UT Southwestern when they need to fill in. This is a place for you to process what's going on. And so as attendings, no matter what department we're in, I would encourage you, if you feel like your trainees or even your colleagues are going through a lot, because we see a lot of stuff as physicians.
Yes, we do.
We see a lot of stuff. To ask someone from psychiatry, or even if it's not someone from the psychiatry department, hey, can you recommend someone that we can come in and facilitate some process groups for us over a couple of weeks? Or and I mean, this is even outside of like debriefing after a big event. Just having some regular space can be helpful. So that's sort of outside of what the individual can do, but I think what institutions could do to be helpful.
That's actually really helpful. I never even heard of processing groups. I think, as you know, I work in the emergency department, so like we tend to see kind of rough summer with a lot of traumas. And there was a point where I was actually developing like my own level of like acute stress or PTSD or something. Where every shift you're just like, I don't know what's going to happen. I don't know. But having a space where usually we just vent amongst each other to sort of say like, how are you dealing with it? And luckily I have an amazing therapist who also helps like me get through it as well. But the idea of having an institution create space for all individuals who provide care, physician or otherwise, is super great. Awesome. Cool. Okay, good. So I'm going to steal that. I may bring that to my own institution. And
yes,
say, hey,
please do.
What do you think about this? When we think about doing this? That's perfect. Cool. So there's a lot of ways we can sort of handle stress and anxiety. A lot of ways. I mean, from the non-pharmacologic, and then as well as some of the pharmacologic measures that we have, and also relying on groups. Like it takes a village to get through anything. So a lot of ways. What are the things that we should be like avoiding, like when times of high anxiety or times of stress, or even if we have a generalized anxiety disorder?
The first thing that I thought of was like drinking or doing other drugs excessively. And I think that can be a common way of coping for us, right? We have a really hard day, shifts, just go get wasted.
Right.
And that's not everyone, but that is certainly some people. And so, I would say that is not the best way to deal with it. I mean, we're physicians. We know what alcohol does to the body. And yet we have to try to figure out a way to cope, right?
Exactly. How do you heal thyself and also damage thyself by taking care of others? Exactly. Yeah.
Yes. So I would say, those are things to avoid. The whole issue of like marijuana, edibles is really interesting to think about. People are using them a lot more to cope more casually. I feel like since they're legal in a lot of different states, now that could end up causing problems for you potentially for your workplace, if it's a drug-free workplace. And then, God forbid you get a hold of something that's terrible and like have a psychosis that you can't come back from. Now, I'm psychiatry, so I see that, right? So that's my bias.
Definitely. I've definitely seen those. Unfortunately, those teenagers in the emergency department who smoke the wrong thing. Exactly.
Yes. So, I caution against sort of becoming over-reliant on substances to manage. I think other ways that are unhealthy to manage, just not talking about it at all. Yeah. I think another thing that can be tough is that you shouldn't do is just quit. Right. And I say that cautiously because like sometimes maybe it is a good idea for you to quit whatever it is the thing that you're doing. Maybe that is the right thing. Right. But I think it would be good to talk to someone about what is going on with you to see if there are any other solutions, because you might quit and then realize like, oh, the same feeling that I had at that last place, I still have it. So like maybe it wasn't the place,
Right.
Maybe
I
it
mean, and there's
is.
a lot of ways of just like learning the skills through, it's like courage through fire type of thing where,
Mm-hmm.
maybe I didn't burn the house down with a spider and the spider was
Mm-hmm.
only on the counter this time. And I got through it being on the counter and then,
Yes.
the next time I see it, I'm not as freaking out.
Yes.
And then that's true. Cause even as you get through training, I mean, at least for me, when I got through residency and into fellowship, my anxiety level when it came to dealing with other physicians and other like expectations
Mm-hmm.
went down because of obviously going higher up in rank, but also but also just getting exposed to more. We're just like, no, like I've proven myself time and time again, and there are situations where I feel great, and there are situations where I feel not so great. But trying to learn that it's not me always; it also can just be the
Yes.
external environment in which I'm in.
Yes.
So that's a really good tip.
Absolutely.
Yeah,
Absolutely. So, yeah, I'm trying to think of other things, other maladaptive. There are so many other maladaptive ways of
right.
coping: restricted eating, excessive exercise or over exercising, which can end up not being so great. I'm just trying to think of other things that I see. Certainly, being explosive towards your colleagues,
Oh,
right?
yeah.
If it's that irritability,
Right.
I say that's a thing not to do, recognizing that it could also be a symptom of your anxiety and you just don't know how to manage. But I would say, like, if that's happening, it's a good time to like pause and
Call somebody.
talk to someone about what's happening, right? So those are some of the biggest things that come to mind. I would say benzodiazepines. It's a legal substance, but I personally don't like to prescribe them because of their high addictive potential, as we all know. I mean, of course, they feel super great, but that's something I would say not to do, to try to find more of a permanent solution than just a quick benzo.
Right. And for those who don't know, benzos are like the Valium, the Xanaxes, those classes of the world. Yeah.
Yes.
I remember when I'm out sharing all my horror anxiety stories today. Well, it's fine. It happened in the past. It's great. I survived. Everything's great now. It's wonderful. But no, I remember my first psychiatrist I ever saw was in med school. I never really had anxiety issues, despite the fact that I talk so fast. I actually am not anxious most of the time. And she was like, we're going to put you on Prozac and Xanax PRN. And I remember I took the Prozac and I took a Xanax before, like I went into like the weekend of studying or something, and then so exhausted, and then went to surgery rotation, and there was an Adele song that was playing on like the music, and then the tears that came out of my eyes that I could not control because it made me so emotionally labile. Like I was just like crying. I cried so much that like my mask was soaked, and they had to ask me like, it was the most embarrassing. So you guys be very careful with these psychotropic medications. So I had to go back to my psychiatrist. I was like, actually, I can't be on this medication. What the heck is going on? I was so crying. I was like, literally, and it was literally just like it was just like I wasn't even sad. I was just like, it was a beautiful song. I am a crier at baseline, but like it happens. But yeah, the Xanax didn't help. The Xanax and Prozac was really just messing me up. So, but I learned a lot of it is like just like you said, like CBT, like cognitive behavioral therapy. It was like really what saved me, at least. Like luckily I'm no longer on any medications, and I think because I really had amazing therapists that sort of was very patient and took the time to sort of be like, okay, like that happened today, and then that's one of the things I really love about what you said about staying in the environment if you can, if it's not dangerous for you to stay, if you stay in with help, with not by yourself, with help, that there's the ability to learn through the fire that you're in. So it doesn't feel like fire anymore. And then you feel so proud when you're just like, you walk back in and you're like, yeah, I know. I don't know that. It's okay. I'm still going to graduate. What's going to happen? Like, it's It's still amazing. It's going to be great.
That's the most powerful feeling. That's the most powerful feeling. Yes.
Conquering that anxiety and just being like, yes, I got this. And also just knowing, anxiety is such a normal part. Just like we said earlier, it's such a normal part of life. I always find those who are not anxious to be a little weird. Like, how are you not? What do you think the world is that great?
Yeah.
Like, it's just like,
yeah.
But yeah, it's a balance. You're right. It's totally a balance of everything. But I really loved what you shared today. It was really helpful to sort of just
hear. Thank you.
I feel like I should give you my insurance card and I might pay you a copay for the last hour. I really appreciate it. It's been really good tips. Before we close out, I don't want to take up too much of your time. Do you have any like final things to say or any words of wisdom or anything?
I guess I would just say that like training, this is for trainees, it can be hard for sure, without a doubt, but it shouldn't be absolutely miserable to the point that you cannot function, whether that's related to anxiety or depression and just feeling like you can't go on. And so just really encouraging you to talk to someone, whether it's your chief, whether it's just another colleague or something like that. And it is for physicians as well. So yeah, that's my take home, is just to get help if you feel like you need help. But there's tons of stuff online about anxiety and symptoms. So we talked about some of them today. And if any of those ring true, it would be worth talking to someone about to see what can help.
Definitely. And we'll definitely take some of those notes and put it in the show notes so those who are listening can get access to some of the resources that Dr. Busch talked about today. All right. Well, thank you so much for coming on the show. We hope to have you again soon. It's so much fun talking to you and catching up.
Thank you. You too.
Awesome. And thank you all for listening to the Black Doctors podcast. Before you go, make sure you show us some love for your favorite Black Doctors podcast out there. Rating us on Apple Podcasts, Spotify, wherever you listen to the show, just give us a review. We'd love to hear from you. Also, if you're interested in learning more about the topic like we discussed today, I'll drop some resources in the show notes. And you want to learn more about the fabulous Dr. Bianca Busch, please check her out. All her work is at psychiatrist.com. Stay tuned every week as we tackle issues that are relevant to you. This is the Black Doctors Podcast, where representation matters. Talk to you soon.